Welcome to the K in Clarity podcast. I'm the host, Mezue. During this episode, we're joined by Neel Mehta, a previous digital health startup founder and health tech industry professional. Neel has been instrumental in driving entrepreneurial innovation and strategic leadership within the technology and business development space. His diverse career includes roles at prominent organizations like the Adani Group and Philips, where he contributed to strategic growth and technology advancements. Additionally, Mehta founded his own startup, showcasing his ability to pioneer new ventures and navigate the challenges of entrepreneurship. As a TEDx speaker, he also shared his insights and expertise with broader audiences, inspiring innovation and leadership within various sectors. His multifaceted experience positions him as a versatile leader capable of driving change across different industries. In this conversation, he shares his extensive experience in healthcare, digital transformation, and innovation. He discusses the promising future of healthcare, the complexities of digital transformation, and the importance of identifying pain points. Neel emphasizes the need for resilience in healthcare innovation, the long journey to effective solutions, and the critical role of data quality. He also highlights the significance of structured pilot programs and the necessity of being bold in healthcare innovation while remaining agile and responsive to customer feedback. Additionally, Neel shares insights on navigating the complexities of healthcare startups, emphasizing the importance of understanding market dynamics, identifying key stakeholders, and building relationships. He discusses the challenges of engaging with healthcare systems, the necessity of bypassing middlemen, and the critical role of founders in driving their startups towards profitability and growth. Lastly, Neel also highlights the significance of listening to customers and focusing on core challenges to scale effectively in the healthcare sector. If this is your first time tuning in, here's the gist. The healthcare industry is buzzing with innovations, but there's a lot of noise and misconceptions out there. That's where we come in. Because of my experience in the healthcare ecosystem, I've gained a unique vantage point into the industry's inner workings. We're bringing you the conversations that typically happen behind boardrooms and strategy sessions, the real challenges, innovative solutions, and game-changing insights that are reshaping healthcare as we know it. On this podcast, we're bringing you face-to-face with the industry-leading healthcare founders, executives, and innovators. We're talking about the nitty-gritty of building and scaling healthcare companies, the hurdles they've overcome, and the strategies that have led to their success. More importantly, we dive into the personal challenges that come with trying to change a system as complex as U.S. healthcare. So whether you're a healthcare entrepreneur, a medical professional, or just someone passionate about the future of healthcare, this podcast is your backstage pass to the minds shaping the industry. Now let's have Neel tell us a little bit about themselves. Welcome, Neel. Thank you for your time today. For the people listening, can you give us a little brief overview of yourself?
Sure. Thank you for, first of all, having me on this podcast episode today. My name is Neel, and I'm here with a deep healthcare, digital health, medtech experience. I started my schooling back in the day in 2000, early 2000s, and then graduated and did my undergrad in bioinformatics, which was very new terminology back then. And then eventually did my master's in passing as well as a graduate education from Arizona State University in biomedical informatics. It's been a journey since then, from early 2000s to now 2025. Have pursued a lot of major academic publications on the research side, as well as fostered and arrayed myself into the world of entrepreneurship, co-founded a healthcare startup, and now eventually doing several other business related activities along with social impact, mission driven organizations support, and also enabling other fellow entrepreneurs to launch, grow their businesses. So stay tuned, and I'm really excited to share some insights with you and also learn from you.
Perfect. Thank you for that intro. What we usually like to do here is an icebreaker, and I know we're going to talk about digital transformation as well. I know you've been on a TED Talk, so I know you have years of experience. But with our first icebreaker question, I believe you see yourself as someone that's a healthcare futurist with a very unique perspective. So how do you think that's really aligned yourself as you've gone about in your career, as you've gone about through your work and your journey within healthcare?
That's a great question. Thank you for asking me that particular. So, when I tagged myself as healthcare futurist, it was not that I put down that fancy I would say, a terminology next to my name. It was actually delivered to me by the media, by the people I look up to in the community, as well as based upon my accomplishments and the results what I've been able to deliver in the community. Because there can be a lot of self-proclaimed people that okay, they are this, they are that, but it is more about what people call up to you and with due respect give you some titles. So that is how it came about to be. Now the reason why it came about to be is not that I did something very futuristic or a sci-fi like from the movies per se. We are into the business of healthcare essentially with a focus on serving and supporting patients to ensure that we can increase their outcomes and create a positive impact in their lives and essentially improve their health overall and well-being. So that being said, with my previous startup experiences and the professional experiences working with some of the large medical and hospital healthcare systems, the activities what I pursued, the impact driven results what we generated with me leading the team as well as contributing as a part of a larger organization enabled me to receive that title. And sometimes it was more on what measures we are going to put into the place to create a possible viable better future. And sometimes it was more about how can we go back and take the best practices which were prevalent back in the day and bring it to life today. So it was a combination of taking the lessons which have been useful in the past, applicable today in the present, and can be a long and sustainable in the forthcoming times.
I like that. With what you've said, where do you see the future of healthcare for business, for startups and larger organizations as well?
Yeah, so the future of healthcare is very promising. It is something which is very difficult to crack, but at the same time, it takes care of more than 20% GDP of United States of America, the US, in which we are part of. And so that is a very big component. It's not just something which is optional to the country or to the people. It is an essential part of it and creating an impact in a way in the form of a service, solution, product, offering, or a marketplace can be a game changer. Now, with such a large healthcare ecosystem which is already out there in the market, it is not one of the most easiest application or a foray that is venturing into that particular ecosystem is there, right? It is not as comparable to a fintech industry or any other industry per se where 1 plus 1 is equal to 2. When it comes to healthcare, when it comes to patient, when it comes to drugs, when it comes to products within the healthcare ecosystem, it is need to be defined in a way where it is applicable and personalized based upon the problem statement which you are intending to solve.
Very simple, but very impactful for leaders to remember. I know in our previous conversation as well, we had talked about how digital transformation can really be optimized in workflows for these organizations. Can you expound on that and what you really believe and what you've seen from your experience and how these large organizations can actually digitize and really bring about the type of change they want to see as well?
A great point. So, healthcare transformation, digital transformation is a new synonym in today's industry in the 21st century in which we are part of. Everyone wants to digitize their process flow, patient flow, organization flow, and as well as hospital flow. It can be in the form of a clinical flow, patient flow, which is the organizational flow, as well as the informational flow. But just having a mindset that okay, I just want to simply digitize it will not work once again in healthcare, in medical space, because it's a very complex systems to navigate, right from a patient walking in into a reception, filling out a patient form, all the way to going into the ICU, going into the surgery, going into the post-op, going into the rehab locations or the ward locations, and then doing a discharge, right? So, how, first of all, you have to understand the complete flow in each hospital or health system, what you want to create in the form of a transformation or digitization. It can be in the form of just the clinical or the informational flow which I mentioned about, or it can be in the form of a financial flow as well. Once you identify what you really want to do and understand the pain point of the existing provider system, which is the healthcare system, then you can go back to the whiteboard and start mapping out what is there, what is not there, and what is required. And for doing all of this, what will be the budget or the cost to do so, and then putting everything together and getting all the necessary approvals in place to kick off that project. That then only a true digital transformation can happen. See, in banking industry, I'll again come back to fintech because that's very popular, that's very trendy. Everyone wants to be a part of a fintech or a financial revolution. That is where once you create a digital flow, once you create a digital roadmap, it will be applicable for bank number one. Same thing will be applicable for bank number two. Because when you deposit your dollars, right, it reflects in the very same way in bank number one and in bank number two. But if you walk into a hospital, like hospital number one, and have all the clinical treatment done, and then when you walk into hospital number two and get all the clinical treatment done, it is a completely different experience. It's not just the UI change or the color change or the interiors are different or the location is different. It's a complete methodology through which the hospital or the healthcare is designed varies from one place to another place, varies from department to department. So, in bank, a cashier will do the same thing. Reconciliation will happen in the same way. But in hospital, the treatment given by one doctor for the same medical condition will be different in comparison to doctor number two. So if you go to doctor number one and say, I have a flu, I am having cough and cold, I am not able to sleep for the last 5 days. After hearing your chief complaint, which is the CC in the EMR or the EHR, which are part of the hospital system, doctor number one will prescribe set of medications and set of treatment plan. The same chief complaint to doctor number two in hospital number two. Your medications and your treatment will be way different, which will not be the case in the banking industry, which will not be the case in any other standardized industry. So when it comes to healthcare, it is something where it is lagged in terms of digital adoption, digital transformation, because of the complexity, nuances, and a need of hyper personalization, which is required to operate and also to create better impact results for the patients.
So, what can, businesses, organizations really do to crack that code and manage that complexity within there,
That's a billion dollar question,
isn't
essentially.
it?
Yes. And so, in order to crack the code, you have to identify a pain point which is recurring in nature. What I mean by that is that hospital number one also have the same pain point. Hospital number two also has the same pain point. Not with respect to 1 plus 1 is equal to 2, but they kind of similarly identify that this is a pain point today. So, for example, if you take about any medical condition and that condition is getting misdiagnosed multiple different times, despite doctors, despite specialists, despite hospitalists putting the best efforts, but it creates a lot of complexity for the patient health and longevity, then that is a problem which you have been hearing again and again across various hospital systems from various patients. And then you go back to the internet. Back then, when we were doing the startups, we didn't have AI, LLMs, ChatGPT, all of that, right? But now you have access to all this latest information plus Google and identify what is the actual problem statement which can be quantified. And that quantifiable value times X amount, you put a dollar to it, that gives you the total market, total addressable market, which is the terminology TAM. So once you see that your TAM is at least like 100 million plus or 200 million plus, that is the kind of the problem statement which you can now start thinking about it and start working towards it. But you also have to add something to that, which is Are you really passionate about it? By solving this problem which you have identified, is it meaningful for you, right? There are a lot of Wall Street bankers, Wall Street journalists who are just in New York because it pays a lot. But if you ask them a deeper question, are you really passionate about what you are doing? Most likely the answer will be no. In healthcare, the result of the problem statement, what you identify, will take years. There'll be highs and there'll be lows. So, unless and until you can connect that to your purpose or to your passion, it will be very difficult to create a tangible, practical, realistic, and applicable, which is very important, applicable solution to get into the healthcare ecosystem.
Very deep. With what you said there, how can one really tie themselves into building an innovation that takes years, right? How can they mentally be strong? How can they really provide a way to build that applicable solution and go from there?
Correct. Great question. So it comes back to your domain understanding. So if something like is a calling, right? That okay, I really want to be in healthcare because this is a problem statement what I am seeing in the community. Maybe my some of my family members have experienced, which is always like the most tight neat reason why there are a lot of healthcare entrepreneurs disrupting the ecosystem in the positive way because their family, their loved ones, or their near and dear ones unfortunately have gone through that bitter and sad experience, right? And they don't want the rest of the community and the future generations to experience that. And that's why they roll up their sleeves and dive deep into solving that problem. That is one way to go about it. Second way, it's not that you need to have that cause in order to do it. Let's say you are a completely outsider, you have no visibility about healthcare or medical device industry or pharmaceutical industry or any other verticals or horizontals related to the healthcare as an industry overall. Then you really have to think about, okay, why am I taking this problem? What is my ROI? See, in healthcare, there are two types of ROI. One is definitely the capital appreciation, that is the X, 3x, 5x, which is always the goal that I really want my startup to grow at this pace. I want to create a 10x business. I need to create a 20x business. That is one capital approach, revenue approach, wealth approach. Correct. The second approach, the second ROI which you get is the number of lives which you're going to improve at the end of the day. Or, in fact, even deeper would be the number of lives which you'll be saving at the end of the day. So, there are multiple ROIs associated with healthcare and medicine. It's not just about money, money, money. It is beyond money, it is impacting human life. If you are also into the veterinary space, it is also impacting animal lives. So when you are thinking about dabbling or getting your hands dirty into healthcare, you have to look at ROI from both perspectives. If you're looking for an ROI where it is just about the capital appreciation or doing an AI based LLM startup, raising $2 million dollars in Silicon Valley today and selling it for 20 million after 2 years in Silicon Valley, that kind of next growth you will not see in healthcare. It takes at least 3 to 5 years to build your foundation, and then you will start seeing the reverse hockey stick in terms of the number of patients using it, number of doctors appreciating or supporting that, number of hospital ecosystems partnering with you, and eventually it is getting integrated into the day-to-day lifestyle of your end users.
Okay. So usually you're saying it takes 3 to 5 years of just
Minimum.
to start, minimum just to start. Now, what does the rest of the journey look like? Hopefully as you potentially start to achieve scale, how many years does that take? Can you dive into there a little bit?
Sure, it's a decade-long journey. You have to put about 10 years in order to step into the traditional form of healthcare solutions. Digital healthcare or medical technology, where you are just focusing on the technology as a means to solve some of the gaps into the system, like a platform, clinical decision support application, or a patient doctor communication portal, which was the need of the hour back in the day. Now you have multiple platforms still getting built, still getting funded, right? Because the need is so huge. Think about it, 300 million Americans are your target market. That's the largest target market you can ever have, right? Not everyone is going to be in Silicon Valley, not everyone is going to be in Wall Street in New York, but every American or every resident who lives in US will eventually one day or the other day might become your customer or might become the user of your application. So how you segment that, how you derive that, that will take you at least 1 to 2 years to identify your target market. Then comes all the long form of regulatory approvals. It is not any other hospitality based or F&B based or logistics based application that you build it and you go live, you put it on the app store or you put it on the website, and then you get users by running performance ads on Instagram, and then off the businesses off the ground. Even before you do all of those, which you can do directly in traditional business, in healthcare business it is very important for you to get all the necessary regulatory approvals. That means you need to figure out whether you need FDA approval, whether you need a 510(k) approval, whether you need clinical trials to do if it is related to drug, or if it is related to any form of patient inhalation all the way to patient digestion. So if it is a product which will be consumed or inhaled by the patient in the hospital system, then there are additional regulatory approvals which are required for you to get the certifications, get the necessary guidelines to be completed. And for that, you need to work with other subject matter experts who are pretty good at that. Once you get all the approvals, then only you can initiate the marketing efforts to drive sales, to drive revenue for your business.
I like that. With what you said, it also spurred a thought for me of how do you tackle a problem of digital infrastructure within healthcare? What are your thoughts there?
Yeah, so that's, I would say, infrastructure can be inside the hospital or outside the hospital. Let's say you are a solution provider. You have to first of all identify whether I'm going to reside within the hospital infrastructure. Then you need to have a local architecture. If I talk a little bit on the technology side, whether it will be on-premise solution or if it is going to be outside the hospital system, then it can be a cloud solution as well. First of all, what kind of solution is you are building and how quickly the solution needs to be accessed. About 10 years ago, you cannot access cloud at the speed which you can access today. So if you have a large gigabytes of data to be processed, of the patients, of the pharmacy, of the labs, of the prescriptions and everything, then you need to have a local IT infrastructure. But today, the cases are different. Now you have to understand the computing cost associated with this. So if setting up an IT server within the hospital system requires a lot of approvals, dedicated space, which sometimes physical space is not available with the hospital. They are always running short on space. It's not like hotels, right? You go and check in at Marriott, Hilton, you'll see huge lobby, right? They have all the space in the world because it's a welcoming, very leisure, very relaxed environment which they are creating. But if you walk into a hospital system, don't take Mayo or Kaiser Permanente as an example, right? They are the world class, best in class hospitals. But if you look at like the hospitals which rank number 50 onwards, right? Not the top 50, but beyond top 50. You will see they are always in a compact space. They are in the middle of the city where sometimes parking is also very difficult, where even they don't have enough room for the nurses to have lunches, right? This is the harsh reality. And in that, if you go and say, hey, yeah, I'll need like 100 square feet or a 10 square yard or a complex room in order to set up my digital IT infra, Guess what? Even though if you have the best solution in the world, they are not going to buy it because it's not practically, realistically possible. So that is where you have to compute whether that physical infra will be a way to move forward or cloud approach will be a way to move forward. But in cloud approach, again, you need to have and get all the necessary approvals in place because you are dealing with patient information. So all the HIPAA compliance comes into the play where how you are able to process the patient clinical as well as the pharmacy information in order to derive outcomes. There have been one of the companies which is called Optum in the market. They are huge into data analytics, right? When they started, they could not get healthcare to agree to release the patient data. So they created a system to de-identify the patient information. So they had to put their own cost and own resources in order to first of all de-identify the data, mask the patient names and all the identifiable information, and then get the approval to extract the data to help the hospital system itself. So sometimes in order to just provide the solution what you're looking to give to the hospital, you need to do like 5 steps to reach to that level. So coming back to your infrastructure question, it is the matter of time, that is when you are going to speak with them, where you are going to speak with them, with whom you are going to speak with them, and what is the urgency and the necessity of the solution. Then you can define whether I'll have a virtual one or a physical one or a hybrid.
Also, how do you think about, the quality of data and the innovation of solutions and products and platforms to actually help digital transformation occur?
Correct. So it goes where there is a very well known saying, garbage in, garbage out. So same is applicable in the hospital systems as well. So when you come with a problem statement that using existing hospital data, I will be helping them to derive some decisions, to derive some analytical workflows which they might not have think about it. So that's your end goal, right? To improve hospital performance, to improve patient outcomes using data. Now we have to identify how we are going to collect the data. In hospital till to date, including the top 10 hospitals in the world, I mean in the country, which are definitely some of them ranked in the world as well, lot of patient information is still on the scribe. That is, it's still written on the pen and paper with different handwriting by different people with different level of clinical understanding and at different times of the day. All right. So putting those paper and asking ChatGPT to compile will completely go haywire. It is not going to work. Putting those papers and asking OCR, which is objectifiable compilation systems, where it can extract the data based upon what is written, it will not be able to understand that. Of course, with the standardization of EHR and EMR and with meaningful use, patient centered medical home certifications, which have become a part of the regulations as well as the policies from CMS, Center for Medicare and Medicaid Services, things have improved a lot. Everyone is moving towards documentation on their EMR, EHRs, but still there are certain instances in between the patient flows which are still done on the paper scribe, which sometimes are getting inputted into the systems, sometimes they are not, depending upon the sensitivity, the time. So the first and the foremost foray to get into a data analytics as a solution provider, you need to have a very clear understanding of what are the discrete and continuous data resources you are able to fetch, pull, extract from the existing healthcare system. And after getting those, where and when those points might be missing, and how to also ensure that you are able to invest maybe a little bit more time to get those inputs as well. So, a very practical and real example, I would like to say. Back in the day, I was working for a clinic out in Scottsdale, Glendale, Phoenix, Arizona. So, I have spent about a decade in Arizona as a market. next to California. For those of you who don't know, maybe watching from outside the states. Now, in Arizona, there are multiple different cities getting connected. It's the fifth largest metropolitan region in US. In that, this hospital had 4 plus 5, total 9 locations. Now, in 9 locations, even though there was the same header, that is the same parent company, same hospital name, the doctors at each of the locations used to have a different way of practicing, which goes back to my very first point, right? If I go to a doctor in city number one, hospital number one, they'll treat me differently as compared to hospital number two, city number two. That same problem this clinic was also facing. So, as a part of my digital IT, digital healthcare background, one of the key problem statements which I had to solve was to standardize the patient notes. So, irrespective of whether the doctor in one of the clinic locations or the second clinic location sees the patient, they will follow the standard protocol. Now, I'm talking again this thing about a 10 years before, like in 2015, in 2014. That is where the digitization or digital transformation was not there. So every doctor had their own ways to see the patient. So if a doctor has like 10 plus years of experience and you are like in your early 20s, like fresh off the board, fresh off the college graduation, you walk up to a doctor and say, "Hey doc, can you please follow this process?" Do you think they are going to follow? No, right? Because they think that they are the domain experts, they know everything about the medical industry. You have no visibility about what you're talking at that time. You have to understand that you are there for a bigger and greater goal, for data standardization, for clinical information streamline process. So after multiple attempts, I would say processes which we created, we were able to achieve 87% standardization, but it took us 6 months. So if we think that, okay, I'll just go write an email, tell to all my docs that, okay, follow this process from tomorrow, it's not going to happen. So coming back to your point about having a data analytics or a data related company to create meaningful outcomes, you need to start from the very basic is my data standardized?
I know you had mentioned your thoughts on pilot programs within, working with these systems. How do you think pilot programs can be, structured for mutual benefit with the person providing the solution and the multiple stakeholders involved?
Okay. I can speak on hours on this. You touched a very personal point and personal experiences which I've gone through previously while I was being an employee of various organizations, as well as a part of my co-founded startup back in the day. Pilots programs are very critical for any new idea, especially something where a testing is required, something where practical applicability is to be reviewed. Hospitals will not directly pay you for the product or the solution which you are bringing to them. They will like to see whether this is something which will be useful for them. This will be something which will be used by the end user. It can be nurses, nurse physicians, nursing superintendents, medical directors, whoever may be at the hospital, they need to use it and also determine what is the frequency it will be used, when it will be used, and how it will be used. So these are all the usage frequency needs to be determined. Number one. Number two is why it needs to be used. You can go to the doctor, to the hospital and say because of 1, 2, 3, 4 reasons which you have pulled from like Google or ChatGPT, or because of the theoretical understanding, you are putting that information to those doctors and saying that this is the reason why you have to do it. Then again, doing that versus an applicability in the hospital is way different. So they would like to test it. So considering all the scenarios, what typical every hospital or healthcare provider will ask you to do is to do a pilot. Now, pilot is something which can be very important to you as a startup founder, as someone who is starting in the healthcare system, because you're getting the foot in the door. That is, you're getting a step to actually validate your hypothesis, validate the product what you have been building in the labs or in the office. But now, if you do a pilot, it has to be structured in a way where it becomes a win-win situation, which is exactly your question. Now, answering that question can be in multiple different ways, but to the point answer is that you have to create a scope of work document saying that, hey, doc 1, hey, hospital 1, we are ready to do the pilot. It would cost us X amount of money because commuting, investing in your tools, giving licenses, using the cloud infra, if it is a digital solution. If it is a physical solution, putting all those medical devices into the hospital, right? Or running those devices 24/7 over there, training the hospital providers for those devices or for those tools or for the applications, right? That is also a cost because you will be putting your own resources, will be guiding them, training them, and ensuring that they are using it. So outline all the things what you are investing, that is putting out of your own pocket. So some of the cost will be a direct cost, that is actually you're going to put your own money to get this done, and some of the cost will be indirect cost, that is the resource cost. But at the end of the month, you are also paying your resource, right, on a bi-weekly basis. So you have to also highlight and identify that I'm putting my clinical person, I'm putting my technology person, or I'm putting my engineering person, or I'm putting my data analytics person to take care of all of these things as a part of the pilot. Now, this is a total cost which I'm going to incur in order to showcase why my product is better in the market, why it is needed by your hospital system, and what positive outcomes I'm able to derive for you. That's phase one. But as you are going to do that, you also have to tell them that if I'm going to put X amount, and if these are your expectations which you have already informed me, if I'm able to reach that in 60 days, in 90 days, you will give me a purchase order and get it signed. Not by one person, but at least three people in that hospital, healthcare, clinic system. Why? Because one person can leave tomorrow. They can move hospitals or they can move across the country, right? So you need to have sign off by multiple stakeholders so that when that desired outcome, what they are looking for from your solution, again, be it physical, digital, we are not talking about that at the moment. You can expect that I'm going to get that purchase order, which will not only bring me the money which I've already incurred as a part of pilot, but little bit more so that then I can use that money again to go to the second hospital, right? And that is only when they will become your customer and they will start valuing your offering. If this kind of structured pilot is not defined and not signed off, it doesn't matter whether you say, okay, I'm doing a pilot at Mayo Clinic, and then you get 5 news channels and media outlets to talk about it. Because today you will feel great, yes, you got a pilot, Mayo is on it, and they are using it. But after 90 days, are they actually going to pay? And if they don't pay, that means your offering is not valued there. And then it becomes very difficult for you to sustain your business operations.
Very thorough and concise. Another thing we talk a lot about on this podcast is how can you be bold with innovation in healthcare. So, what would be your advice to leaders and founders as well to be bold and provide innovative solutions, and while implementing those solutions, as well as while navigating the challenges and the regulatory infractions they may see. What's your advice there?
Yeah, this industry definitely requires a lot of boldness because, again, the time is of essence. It's not something where people have leisure time to experiment. I'll give you a parallel example. If you walk into a five-star hotel reception, right, and if someone asks you to take 2 minutes to fill out the survey, chances are more than 50% of those guests will do it because they have time in the world. They are there for staycation or recreation purpose. But if you go to the hospital and ask the doctors to fill out a form, and even if it is going to take 2 minutes, they are not going to do so. because the patient is calling them. The time is of essence. So until and unless you are very sure that this is a game changer, this is what is going to impact in one way or the other way, it is going to create a positive difference, maybe in the provider's life, that is doctors, nursing lives, or in the patient lives, or as a overall systems together, no one is going to listen to you. No one is going to give time to you. There is no time for just experiment. It's not like a college project, or it's not like a weekend hackathon that you just create a module or a product or a plugin or an automation. This is where you are going to deal with people's lives, the patient lives. So you have to be very clear that what this idea is about, why you are executing this, what is the impact you want to derive out of it, and you have to start with a big audacious goal. That is, this is what I want to achieve today as a part of this particular mechanism, as a part of this particular startup, as a part of this particular company, and you gotta listen to it, and you gotta give me 2 minutes of your time, because it's going to be helpful and meaningful to you. If not today, starting tomorrow, once you complete pilot, or once you review on your own end and take a day or two to experience it. Once that is done, let's see how it is going to create a positive transformational approach into the overall aspect of the challenges what you are facing today. And my goal is to minimize that, or at the end of it, completely eliminate that. So you have to be bold when you're going and making those sales pitches. You have to be bold to the FDA that, hey, even if you don't have any line of sight or a protocol to approve what I have built, or what we have built, or what I'm part of, it needs to get into the hands of your my customers. So what are the ways you can give me the approval? Again, I will give a concurrence example over here. 10 years ago, when we were building this clinical decision support application, there was no way in FDA that they will approving a digital approval. I mean, they are not giving approval for digital applications, right? There are a lot of clinical decision support tools, because we are guiding the doctors of what to do based upon the clinical evidences, based upon the patient data, based on the analytics, based on the gold standard. So eventually, after a lot of back and forth with FDA, with the regulators, they eventually announced that this is a new way for all digital application companies in the country to get approvals. But that led about 18 months of journey for us to continuously monitor what's happening in Washington, what's happening in FDA, what's happening in healthcare, as economic policies as well as clinical policies. And then when that pathway was created, immediately we applied for that pathway for the approval to be in place. So until and unless you are thinking, okay, that I gotta do this, I gotta get approved, I gotta do it in a very legal and regulated approach. And if you're not sure of what you're doing, then no one is going to take a chance or take a bet on you.
Hard advice, but still true. I think with that as well, with healthcare, as you mentioned, it's very laggard with certain things. So how can you be agile and responsive as well, in your implementation and your innovation there, paired with all the advice that you just gave?
Yes, so I would leave it to two words, which is customer feedback. So the only way you can fast forward your innovation is when you listen to your solution provider. That means your end customer. So if you are building an application which is going to be for patient, let's say they have to download from the app store, and it is for the condition, maybe for cardiology or for nephrology or for, let's say, orthopedics, then you have to speak with the patients who are suffering from those conditions, so that the more and more you hear, we call it customer interviews. We will listen to a lot of patients back in the day for our clinical applications and understanding the problem what they are facing through, and then we'll collect all discrete form of information which we have received from multiple customer feedbacks, and then see what is the common voice which is coming out of it, right? A lot of patients says that this is the problem. Then again, the patient from LA will say the same problem. A patient out of Miami, Florida will talk about the same problem. A patient out of Chicago, Illinois will talk about the same problem. When we hear, okay, that the problem exists not only in geography but across the geographies, then we'll think about it, okay, that this problems associated solution, what we can build, must be there as a part of our solution offering. So the moment you do that, adoption automatically comes because they want it, right? They want it because they have said it because that's a problem for them. So one of the questions which is very powerful, and maybe you can take a note or highlight that, is that when you go to your prospect, that is your potential future customer, while you are building your product or solution, you should ask this. And this was given to me by one of my mentors whom I admire a lot, whom I admire today and whom I will keep admiring in the future, is you have to ask this. What is the single most challenge or problem you are facing today because of this condition or because of this methods or because of this process? And if I create a hypothetical but a practical solution tomorrow, will you use it? And at the end of it, will you pay for it? Take a moment, think about it. But the answer to these four questions as a part of this entire statement will help you to get the most fundamental problem what the system is facing today, what your prospect is facing today. And then they will open up and they will say, because until and unless you put an associated dollar value to it and ask them to use it, everything else what they'll be talking about will be just peripheral, will be just superficial, will be just on the surface, will be something what they are reading in media or they are hearing from their peers. But when you talk about it, that if you solve that problem, will they use it? If the answer is no, guess what? They are anyways not going to pay for it. That means that's not a problem. You have to think about some other problem. The moment they say yes, that they will use it, that's good because everyone wants to use everything for free. You see on the App Store, there are more than 10 million apps for which people never pay. They build an amazing app, but then the company dies because they could not convert that user into a paid subscriber. So when you ask your ideal customers that, okay, will you use it? That's great. Everyone stops there. And the founders will be like, yes, now my doctor is going to use it. Now this will be the next $1 million startup. But then ask one more deeper question. Will they put, will they take out the credit card? Will they wire you the money to use that solution? When the rubber meets the road, when you ask them to put the skin in the game, then the real problem will come to life. And that is where you can move from that laggedness, because there is a lot of laggedness because we are not asking the right questions. That we are just asking, hey doc, what's your problem? Hey patient, what's the problem? Patient will say, okay, it takes me a long time to go and do my refills. But then you ask, okay, great, I'll create an option that it will not take you a long time and your refills will be delivered in 5 minutes. The patient will be like, yeah, I'll use it. But then you ask, will you pay $10 more for that? Right? If the patient says, no, I'll not pay that $10 more for that, then that's not a problem for which you need to work on. It's very simple, right? Uber and Lyfts and Waymos are there now in the market. But during prime time, they incentivize the driver to come to the locations where there is high demand and less supply. And those drivers will move from wherever they are. They will even drive like 30 miles because then they can get the fare, right? So to solve the supply problem, to solve the demand problem, Uber as a platform is incentivizing their customer, which is the driver, not you, the driver, to come 30 miles. But then they are putting a dollar value to it. That's why they are coming there to pick you up. They are not coming there for charity. They are thinking, okay, my 30 miles driving cost will be covered if I'm in this region for the next 2 hours where there is high demand, and even if I pick up 5 rides, it will cover the cost of my travel, it will cover the cost of my initial investment. Same principle. When you go and talk to your customer and say that, hey, this is a problem what we have identified, and great, you have said that you will use it, you will give us the pilot, etc., etc. We'll write clinical papers, we'll get featured, we'll present in the conferences. But then ask the question, will you pay for it? And there is one more powerful question after that. How much will you pay for it? That's it. You talk to 100 people, ask these questions, you will automatically find a problem, you will automatically find the people that whether they are willing to pay for it, and if yes, how much they are willing to pay for it. Multiply by that your total addressable market, which was my very first point of the first question. Multiply by that, that is your total addressable market value today for this problem to be solved. And then take about 5%, which as a startup you can capture that is the total revenue which you can have. Is that something which excites you to create that? If the number is huge, go for it. If you are not getting excited, find another problem.
I love that. Great advice for, all parties involved. I
Yes.
think to get tactical a little bit, I guess, how do you find the key stakeholders within those early days, right? As you mentioned, in maybe a traditional IT startup, right? You can probably just run some ads, right? You can't really do that in healthcare, especially if you're going to be providing a digital, type of solution. And so how do you really go about finding those key stakeholders? Obviously, I know, your network is important. The people that you maybe do cold outreach are important, but how do you really go about building those relationships and building that traction? And I want to also pair that with how can you actually start building maybe some profitability in those early days of that health startup?
Great question. So, running ads in healthcare is not going to help you connect with your ICP or your prospects or your target market. First of all, you have to understand what is your target market. So, as I talked about a little bit about the buying perception solve using the users of your application. Let's say if you have a digital application, I want to be a little bit more specific to for this particular question. Let's say, okay, if you have a digital application and it is for ophthalmology, that is for the eyes. Okay, as we are like talking on the screen, I thought that this will be a very correlatable example over here. If you have an application for the eyes for the patient, and by using that digital application, now I can track the deterioration of my eyes. Let's take this as an example. No one has done it, and this is something which is fascinating for me because at the age of 60, at the age of 65, everyone goes through cataract, everyone goes through the glaucoma problem. But as an avid Zoom meeting founder, as an avid millennials and Gen Zs who are 80% on the laptops and mobile phones, it is very important to track your eye health. See, we are tracking heart health, right? We are tracking blood pressure, we are tracking SpO2s, which is the oxygen levels, etc. But there is not a single application which is tracking eye health using a digital application. Of course, I can put drops, I can go to ophthalmologist, and I can track everything. But that is transactional, it's not continual. So you came to me and said, okay, this is an amazing eye tracking application. Once we get all the information, we run some complex mathematical permutation combinations. We correlate with your day-to-day usage of the digital blue screens, and we look at your lifestyle. We look at what is your diet. Are you eating carrots, which gives vitamin A, eye health again, correct? So with all those complex ingredients, we can track, okay, by the age of 55, if you continue with this lifestyle, you will need to operate your eye. Here are the suggestions to increase or delay to age of 65. So this is your amazing virtual ideal application which you have built. Now you have to find who will be your customers. There are 4 different customers for this application. One, it can be a D2C, which is a direct to consumer. Of course, we are talking about all the approvals and everything in place. Okay, we are not getting into that. Now you are going to patients. So speak with 1000 people in the age of 40, 45, and that kind of a target market you can easily get it from LinkedIn. You can say, I'll give you a $25 Starbucks gift card or an Amazon gift card. come on a 30 minutes interview. I'll talk for 5 minutes about the product, what we have built, and tell us about, are you actually taking care of the eye? Is that something which is useful to you? That is one way to go about and figure out whether patients, that is people, are going to pay for your product. Whether they'll pay one time to download the app, or a virtual reality application, or a digital application where they have to log in, or a physical tracker, maybe an eyeglasses, whatever you create. Like, is it a device? Is it a digital application? Whatever. The second is doctor. You can think about that it's a prescribed solution. So when ophthalmologist, when an eye physician thinks, okay, that this patient's eye is getting deteriorated and it's not performing as per my expectation, let me prescribe this particular solution. That is the second way for you to get a customer. Now, in order to get that prescribed applications in place, in US, like over the counter, which is OTC, can be bought easily in Walgreens and CVS. But if it is like prescribed one, then has to be filled by the pharmacy. For that, you need to speak with at least 100 eye doctors. Now, how you can go about doing it? Find the largest eye related conference happening in US, and there are a lot of ophthalmology conferences taking place, right from San Francisco, LA, all the way to New York, Miami. And then go there, that hey, this is my application, connect with the doctors for 2 minutes. Can I get your business card? Can you add me on LinkedIn? Can I connect with you, collect their phone numbers? And after that, for the next 3 weeks, connect with those 100 doctors, 200 doctors whom you connected with, and see whether it can be a prescribed solution for you. The third thing is you go to an insurance provider, right? Because insurance companies who are covering the cost of every treatment done by their patients, done by their members, now they really want to save the cost, right? If I'm going to charge an insurance premium of $10,000 from this one particular patient who is now in the mid 50s, but if your solution can help me offset the cost of cataracts, glaucoma, emergency hospitalization, blindness for this patient, and I can increase my patient outcome, thus saving money as my insurance pool using my own data, then I will be willing to pay you $100, $1,000, $2,000. Then I can go and make it mandatory that if you need to buy my insurance today, you need to use this solution. Then I'll give you this discount. So insurance can be your third customer. And finally, you have to look at large ophthalmology companies which are already out there. That is, they have built the names, very simple, like Ray-Ban, right? Everyone likes to wear the sunglasses or the specs of that particular company. They have sorted the distribution. Now they are not into healthcare, they are into the fashion industry, right? So you go and pitch to them, hey, this is a new, cool, innovative product, right? How can you create an additional vertical segment within your own business to increase your market share, to create a good moat, which is a defensibility, and also delight your customers that now you are also thinking about their health and well being, not just the fashion. Then they would also love to partner with you. So, when you create a healthcare product, there is not a single customer ever. There are multiple customers you can go after. You have to figure out what is the most practical way to go about it. And coming back to your second part of the question, where you can be profitable. The profitability is always about your revenue minus the expense to get that revenue should result into net positive number. If that is the case, choose that route as number one or step one to get into the market.
Perfect. I also want to attach to the doctors, maybe how you think about the larger health system. So it's not just the doctor, but the administration behind them. Can you also dive into that, and as well the level of profitability on that side?
That's complex. So if your solution
Very
is
complex.
yeah, very, very complex. So let's say if you're building a large healthcare ERP systems or large healthcare, I would say a complex like an EMR, EHR system, There you have to get multiple stakeholders approvals, right? So Epic and Cerners of the world, which are there, they cannot just go to these four different type of customers which you talked about, because they cater to the entire hospital network, right from patient registration to patient discharge, from most critical segment of the hospital to the least critical segment of the hospital. And their entire objective is to collect every information, either discrete or on continual basis, of the patient, as well as for the doctor who is treating them, and all the nursing and clinical providers who are associated with the lifelong care of that patient while that patient is into the hospital. So for them, in order, as there are multiple touch points, multiple benefits, multiple requirements, they need to go all the way from a top down approach in order to get all the approvals in place. Number one is they have to go to the hospital owners. Now days are gone, you cannot connect with Mayo owner and get your solution approved. Right? There'll be like Mayo Clinic CEO. There are region-wise CEOs. One is in Scottsdale, one is in Rochester, one is in Florida. I mean, correct. These are the three Mayo locations, and there are a lot of Mayo clinics as well, apart from being in US. So you have to identify who is your right stakeholder for any given hospital system, like large systems like Mayo, or large integrated systems like Kaiser Permanente or Sutter Health in California. And then you have to connect with them, maybe a digital way of approaching them through mutual introductions or through LinkedIn or through conferences or through meeting them in person, any form of connect, and then explaining them about the solution, and then sharing, okay, if this solution is something which you are looking forward to using it or looking to do a pilot, who are the additional stakeholders which I need to be connecting with. I'll give you a very parallel, practical, real example. So, Philips is a very large medical device company out there. It's a global company. They have been in business for 100 plus years as of today. Now, they have a digital critical care solution where it monitors all the patient information coming from patient monitors, ventilators, defibs, infusion pump, syringe pump, NABP, IABP, you name it. So if a patient is in the ICU and it is connected to like 5 different discrete devices from all different companies, like it can be Philips, it can be non-Philips equipments. They have created a solution where it will connect with all those different devices and bring all that clinical information into one dashboard view. So now the doctors, that is intensivists, which are called critical care specialists, even if they are not in the ICU, they will know, okay, what is the patient vitals, what is the rate of ventilation at which the patient is on, are there any IV fluids given to the patient, what is the current blood pressure for the patient, any ECG is given to the patient, right? I mean, if ECG is monitored of the patient, all of that in a very integrated, comprehensible, clinical manner, that information comes out in the form of their own proprietary solution. So Philips have built this solutions about 20 years ago, which was back in the day, it was one of a kind, state of the art. But in order to get that solution implemented in any hospital system, be it in US, be it in Europe, be it in Southeast Asia, be it in Japan, or even be it in China, they have, like, those salespeople, the team which is behind the scenes, have to get approval all the way from CEO, which is executive officer, because they have to make that executive decision. CFO, it has to make financial sense in terms of getting that value for the hospital. CMO, which is chief medical officer or head of medical head, whatever the names, every hospital says it in a different way. CIO slash CTO, because it's a digital application, right? It's not paper, it's nothing, right? It integrates all the devices, it brings that clinical information in the form of an iPad or in the form of a tablet or in the form of a desktop application, right? So all the IT approvals needs to be in place. So CIO will approve once the security, once the compliance, once the safety of the patient is being considered. The biomedical team, because they need to also ensure that when this particular solution is connecting with all these different devices across the entire ICU, it is not going to impact the day-to-day workflow. They have to get, I would say, buy-in from the intensivist, right? From the critical care doctors and hospitalists who are eventually going to use it, because they need to go to the top management and say, yes, I need this solution. This is going to help. This is going to prevent the number of patient deaths. This is going to prevent the sepsis, that is a clinical infection which happens in the ICU. This is going to help patient get better quickly so that we can move the patient out of the ICU so that we can get a new patient. They have to get a buy-in from nurses, because now the nurses will say, oh yes, this is great, my documentation time will reduce because automatic documentation is taking place, right? So they should love the product. They also have to get the buy-in from the operation chief operating officer, because at the end of the day he or she is responsible to ensure that the entire critical care unit should work in sync. Now think about it. Philips, age old, legacy, multi billion dollar company, needs more than 10 different stakeholder approvals to get the solution implemented into just one particular department of the hospital, which is ICU. That's it. Now, if such a large company needs so many documented approvals, think about it. If you go and say, okay, I have a ICU solution, you are a startup, you have no credibility, you have no medical approvals, you have no medical experience, it takes long. That's why healthcare is called laggard. But actually, it's a blessing in disguise, because of that laggardness, because of all these approvals. You're not experimenting with patient's life, right? If something goes wrong in computation on ChatGPT, I'll just repeat that example because everyone is using it these days. It's the LLM, it's the agentic AIs, and all the Gen AI's workflow. The only problem which you will encounter is the solution is incorrect, right? If I say x plus y is equal to 1 and ask them to run the integrated model, it will maybe create a different outcomes, but it is not going to change my life. But if your medical device or a clinical decision support guides the doctor, touch wood, but in the wrong direction, that person can lose a life in the next 1 hour. That's why all these protocols, all this diligence, that is due diligence, all this clinical review, all these regulatory approvals are in place, because the underlying objective is to do no harm to the patients.
With what you mentioned there, how do you navigate, those different stakeholders, especially in healthcare, there's lots of intermediaries and this can also inflate cost. And so how can organizations think about that?
Yeah, it does inflate costs. Multiple visits are required to the hospitals, multiple meetings are required to the hospitals. The sales cycle, if I talk from the business viewpoint, which I've also experienced it, is that it takes anywhere between 6 months to 18 months to drive any digital sales, essentially for an healthcare application, be it you are representing a startup application or I would say legacy old businesses of Philips as well, because every hospital system have their own way to assert, that is to review the solution what you are offering to them, to understand whether it is the need of the hour for them, and also to see what kind of outcomes that they can expect. Now, because of this, there'll be multiple stakeholders involved. As a smart person, we really have to identify quickly who is a person you have to speak with and who are those people whom you should avoid speaking it. There'll be a lot of people in the hospital who will say, yeah, I'll help you get the solution approved by CFO, and you will get all excited, and then there will be an added cost, or they will take a lot of time, or they will create roadblocks, or they will say, okay, what's my pie, right? And so it's a very very practical and real situation which happens, and not many people talk about it, but I'm comfortable talking about it. So we should not get bogged down by those naysayers or people who are roadblockers. As a solution provider, we have to identify who are our stakeholders and how fast and how quickly I can meet those stakeholders. And one of the ways is to see, let's say if I have a solution for the hospital, And now multiple stakeholders are involved in this. Let me find my competition, or let me find a similar player in the space who have got the approval maybe last month or last year. And definitely once the approval or once the purchase order or once the buying takes place, there'll be some sort of media which will be writing, hey, thanks to this particular person we were able to sign off on this, or we shook hands with this particular company, or for example Mayo Clinic partners with XYZ startup out of LA. Right now in that article there'll be some key stakeholders name associated with it, that the CEO made that comment or chief medical officer made that comment. Why I'm saying to read those media articles is because it is giving you a blueprint that those two people, those three people who have been in that media or who have been in that write up are the people who are going to make that final decision. So if you meet anyone else in the hospital, be kind to them and request them, can you please connect me with this person? That's it. Don't talk much about with them. Don't spend time with them. At the end of the day, you know that these two people or these two particular stakeholders, when they give approval, I'm good to go. I'll be able to sell my product, sell my solution, or sell my application over here. Rest everyone are good. They are important to me, but they are not the final decision makers to me. So let's avoid the noise and let's get to the people with whom I can get the approvals quickly.
I also call this kind of the middleman problem of how you have these different stakeholders. Is there any way, I guess, to bypass, right, some of those middlemen? Of course, you need necessary middlemen to allow, innovation to happen, but also lives to be saved. But
Yes.
in where the places that I'm going to say maybe in healthcare, it's not always necessary. People just have injected themselves in places to, let's say, have financial gain or whatever the other motivators may be, but is not actually being helpful in the end game. How can you bypass those unnecessary people within there? That's the middleman problem. That's what I call it.
Yeah, that's a big problem, and actually it is becoming even bigger. Like back in like 10 years ago when we were doing the startup and we scaled it and we got a lot of hospital and clinical buy-in, we hardly encountered middlemen because it was not that lucrative. But now it has become super lucrative. It's about like they are like kind of lobbyists which are there in the Washington DC in the White House, right? So they're trying to play a very similar I would say position or the aspect in a non-formal capacity to act as a middleman, and they are looking for the either the best intent for the hospital or the best intent for themselves, or sometimes the best intent for the given enterprise on how it is getting created. So the only way to get across them or bypass them is to be good to them, but being also diligent to them. That means if someone says, hey, you need my approval in order to take the solution forward, or without my approval it is not going to happen, find the reporting manager whom they are going to report. So if it is like deputy operations or deputy operating officer, he or she might be reporting to chief operating officer. So you be kind to them and say, hey, can I connect with your boss, right? Because I believe that as per my understanding, COO is the ultimate decision maker whether this solution will be approved or not. So I 100% agree that your role is important here and you are going to play a very big role. But how can we collectively work together to get the COO approval? So help me reach there. But then do not commit to any form of like, the middleman thing or a success fee, simply put, right? Because there is
Yeah.
no guarantee over here. And so, in order for the long term growth, you have to follow what is in the best interest. And now we live in a digital age and a digital world where connecting with the CEO or connecting with the medical head or connecting with the chief intensivist or chief cardiologist is very easy. One of the other ways for me on or how I've done it in the past is you simply walk into the reception and say, hey, I'm here to meet chief cardiologist. Can you tell me the name and where he or she can be found? Usually 90% of the time receptionists are kind enough and they will say, okay, you go to the cardiology block, you go to this particular floor, you go to this particular office space, and that is where that person will be. And then you just knock on and say, sir, can I come in? Or ma'am, can I come in? And then you just say a quick hi, hello, give your background and say, this is what you're looking to achieve as a part of this particular meeting. Can you help? And doctors, like, if you look at doctors, like, at the bottom of their heart, they really want to help their patients. So if you have a very genuine proposal or a solution, of course, with all the necessary approvals in place, they will open the doors for you.
Hmm. Hmm.
But
I
it
love that.
requires a lot of on ground, I would say, foot, right? Just
Yeah.
sitting in
Yeah.
a nice WeWork office, or being in the downtown, or being at a cafe, right? Like Starbucks is not going to cut the deal. You have to be on the ground, you have to spend hours and hours to connect with the right stakeholders and avoid middlemen as much as possible.
Yeah. Boots on the ground help solve
Yeah, boots
problems.
better, better. I'll take that. Boots on the ground.
I think with healthcare leaders, how do you think they can stay focused in a lot of challenges, a lot of things that they're going, and as well as be hopeful in those daily challenges, weekly challenges that they'll see, in trying to provide and innovate solutions that can actually help benefit providers and patients' lives and even payers to some degree as well.
Yeah, yeah. Payers are the biggest ones in the market right now. You look at the pressure every payer is going through, and unfortunately, we saw some of the news in the media as well, where because of certain patients' erratic behavior or the challenges in terms of the turmoil which is going on, like a tsunami, a lot of payers are also encountering a lot of challenges, right? And so, everyone in the healthcare ecosystem, be it a provider, which is a hospital, be it a patient, be it a farmer, and be it a payer, which is the insurance company. Everyone has their own stake of challenges, and everyone has their own focus in terms of coming up with the solutions what either the community is asking for, or eventually their final customers or the providers are asking for. So now, in order for you to be successful as the CEO or the founder or the head of a given business, you have to identify what are the top 5 problems which I myself have to solve, where I cannot delegate that problems to anyone else. So if you are the founder or if you are the co-founder of a company, one of the key thing for you to have is to have cash in the bank. You need to have enough money in the bank so that your startup survives and eventually thrives. You cannot delegate this to someone. You cannot hire, okay, let me hire an investment banker. He or she will go and raise like $10 million tomorrow. Come on, they even don't talk A for apple in terms of the medical language. They'll not be able to raise money, right? Every investment happens because of the founder's story and the founder's passion, especially when it is pre revenue. They are not betting on the idea, they are betting on you. They look at you as the person who is going to steer the ship, right? All the way from Sequoia Capital to Andreessen Horowitz to any other VCs you talk about on the Sand Hill Road in California or in New York, or healthcare venture capitalists which are coming up in Nashville, Tennessee, and Chicago's and other places. They are betting on the jockey, right? You are the jockey and you have to direct your horse in a way that it becomes successful. For you, that is one thing which you cannot delegate. The second is hiring. It is very important for you to hire the right people. That you cannot delegate. So list down everything which is the key and the core to yourself. Right? Every single week I have 10 things which I cannot delegate, and then I will write everything else which I can delegate. So, for example, like the only reason I'm on this podcast because I really want a lot of future entrepreneurs and founders to create something meaningful in the field of healthcare, because I'm passionate about and I'm proud that I have been in healthcare and I'm currently being in healthcare and I will be in healthcare because it is impacting people with their medical and diagnostic problems, right? The same thing, you have to think what are the things which you need to keep it with yourself, and what are the things slowly by training or slowly by nurturing you can give it to your team, so they also feel empowered that they can do it. So right before this podcast, when we started, I called up one of my team member and gave her two other things which I was supposed to do over the next 2 hours, but I requested her to take care of it, right? So just like that, money in the bank, connecting with the stakeholders, raising capital, motivating the team, hiring the right team, creating a frequency with your co founders, focusing on the right problem to be solved. These are the things which you cannot delegate. But now let's say, okay, you have to find an office space. in like downtown LA, downtown Phoenix, downtown New York, that you can delegate. You don't need to spend time in finding the best office, right? It doesn't matter where you are. All it matters is where your product is today. Getting regulatory approvals, you have no visibility, you have no understanding, you have not studied. Find a good regulatory consultant, work on a success fee model, or which is win-win, where upon reaching certain milestones you will make them this x amount of payment, and upon getting approvals and certifications you will pay y. So they are also on the hook to get you all the necessary approvals so that you can be in the market, right? Now thinking about the logo, designing the website, nothing matters. Delegate to the rest of the team members who would love to spend hours and hours on, okay, what should be the font and what should be the content on the website. No one looks at the website. Every business what I've done, including my healthcare business, the website came after 1 year or 2 years. I'm not saying that the website was not there, but the final polished clear messaging with all the case stories, approval, customers, medias, and everything, we spent hours. Once we started generating revenue, once we started having customers, the hospital doctors, your stakeholders, does not have time to go to your website and see how fancy it is. You are not a D2C company. You are not going to your consumers. Even patients will never see your website because they want to just solve their medical problem, right? So you have to understand what is necessity, focus on that, and everything which is fancy, optional, creative, and it is not going to impact business in one way or the other, delegate to your team. I mean, it is essential to do it. I'm not saying don't have website. But as a founder, you should not be spending weekends and hours on, okay, what should be the right message? Doesn't matter. Go talk to 5 customers. They will tell you what should be the message on the website. That is where you have to focus. So 3 things matters to the founder: cash in the bank, good team, good customers. Everything else, delegate.
Perfect. All of that. And my final question before we go on to the lightning round
Okay.
is how can, founders and leaders really think about scaling quickly, if possible, and if so, in a healthcare setting?
Your first 5 customers will define how quickly you scale. Okay. Because it's completely word of mouth, and it is completely based upon the reputation. So for example, again I'll go back to the ophthalmology problem what we briefly talked about. And if you decided that your solution will be a prescription based solution, right, it is not directed directly to the patient or not directly to the hospital system, then your first 5 doctors who believes in your product or your digital solution and start doing the prescription of your solution, and then you leverage their names, their hospital network in the form of a media publication and media outreach, will define the course of the trajectory as to how quickly you will scale. So if you have a Mayo Clinic ophthalmologist saying, yes, I use this solution, it is great for my patients, and you get that as a testimonial, bam, every other resident or I would say hospitalist who is aspiring and who follows that ophthalmologist at Mayo Clinic as their leader, they will start actually seeing your solution in a serious manner, that okay, if this doctor is using it today, he or she has really seen something special which is not there in any other application which is out there in the community or out there in the market. It's not there with the competition. It does not exist, or it's something really increasing the clinical validity or the clinical outcomes for their patients, right? So find the top 5 leaders in the field in which you want to go and make them your best customers slash cheerleaders the moment you have it. And then once you have them, then promote like there is no tomorrow. Then you go for paid media, then you go for press release, then you go on to the interview on TV, then you go and sponsor large booths at academic and healthcare conferences, right, to showcase what you have done. But if you don't have customers, none of the promotions, none of the highlights, none of the things matter, because it will not help you scale. At the end of the day, every doctor is going to ask one question: who else is using it? And if they get the name of the person that they look up to and they admire, and it is one of their role models, guess what? They will start using it, because they also need that brownie points that they can go back to their leader and say, hey, doc, thanks for using this solution. I got to know. Guess what? I've also started using it. What do you think about this? What are the features you like about this? Should we also tell them that, hey, can we change this particular process flow? Are you encountering any problem? Because they want to build that good relationship, so that if they are the ophthalmology head and if they are just an assistant, they also want to climb up the ladder. So they really need to increase on the clinical value, right? To bring that relationship based growth in a given hospital system.
Now, onto the lightning round. So, my
Okay.
first question for you is, what do you think is the most helpful thing in successful healthcare adoption?
Listening to your customers. The moment you have clear understanding of what they are looking for and you build exactly or something similar to that, you will get your technology or the application adopted. And I have a great keynote presentation on YouTube where I was invited as a keynote presenter for a medical tech conference, and I talked about technology adoption for 30 minutes. Requesting you to go and check it out.
Perfect. What were some words as well that really helped you in your journey to be successful and go through those challenges to provide the right type of solutions?
Money in the bank is better than empty promises. So if I have like five doctors saying that your solution is great and we'll give you the money tomorrow, but then if I have one doctor who says, take my money today, I'll be working with that doctor.
And then what as well was a foundational skill that you think, leaders really need within healthcare?
Humility. So as in healthcare, you never know everything, right? You are not a doctor. If you are a founder, right? You have not gone through the medical school. You don't have any clinical experience. You have not studied for that. If you're building a technology tool in healthcare, you are dependent on the CTO, which you are going to, like as a co-founder CTO, which you're going to work with. If you are going to work in healthcare, you are going to get a clinical application specialist, that is like someone who knows that particular domain, right? If you're talking about ophthalmology, you need to work with ophthalmologist, right? So you have to listen from domain experts, you have to listen from tech experts, you have to listen from industry experts, you have to also be on the boots on the ground to get your solutions in the hands of your customer. So humility is required. You cannot be sort of like arrogant after raising like $5 million that, okay, now I'm the healthcare founder, everything is good, it will automatically sell in the healthcare ecosystem. It will never ever happen.
Mm, perfect. And then the last question I have for you is, what is the last thing that you recently seen in healthcare that made you think that, hey, this is really going to make and change everything?
Yeah, so very unique based LLM models focusing on the privacy, patient privacy for sure, and able to derive meaningful value from that data is something which is I'm very fond of at the moment, and every hospital system is trying to deploy and implement that using any backbone of like ChatGPT or Perplexity or DeepSeek. There are a lot of chaos right now, so I'll not comment on that front. But also, Llama is there by Facebook. So you can think about like taking all those Gen AI application, creating an agentic AI to derive meaningful outcomes for the hospital systems. And I think that that is going to be the future. That will be one of the vertical segment which is going to flourish. But it has to provide the right output. And just to give you a parallel example, IBM Watson was there for healthcare. They spent more than $1 billion and they failed because it could not derive the right output. Healthcare is very, very personalized, it is very, very dynamic, and it changes based on the geography, based on the ethnicity, and based on the comorbid condition of every patient. So, how can you create your model which can cater to all this personalization requirement, but at the same time it can create a viability for a hyperscale.
Beautiful words. Neel, thank you very much for your time on the K in Clarity podcast, for your thoughts, your advice. I think this one is going to definitely be an important one, right? Because, even though we live in a healthcare world with a lot of technology around, digital transformation is still necessary to really provide those type of innovative solutions that we want to see and the change that we want to see. Anything that you want to say as some final words to really wrap up what we discussed today?
Sure. I would like to say, if you're thinking about starting something in healthcare, or if you're into healthcare and if you have any challenges, roadblockers you are experiencing, please feel free to connect with me. I'm happy to consult with you. I'm happy to speak with you. Don't worry, I'm not going to charge anything. I'm not a consultant, right? I have my own means. I also invest in healthcare. But I want to see lots and lots more healthcare companies and startups to be successful, create a good, positive, collaborative ecosystem, and foster the growth in healthcare, which is the need of the hour. And of course, as we talked about, it is a laggard. So, how can we take that laggardness to the more advancement, which the world has not seen it yet? And together we can make a positive difference.
That's what I want to hear. Thank you again for your time.
Sure.
Where can people connect with you, follow you, and really, build that type of relationship?
Sure. The best way to connect with me is on LinkedIn, and I would request you to put my LinkedIn link at the podcast or even in the episode, or you can just hyperlink it over here during the show, however you feel comfortable. And in LinkedIn, I have my both US as well as India phone number, so you can send me a WhatsApp message, you can directly send me a text message, and happy to take the conversation forward from there.
Perfect, Neel. Thank you again for your time on the K in Clarity podcast.
Thank you. Thank you for having me. Have a wonderful day. Talk soon. Bye bye.